Okay, class, so here I have the end of chapter 17, or what I call part 2. We left off with slide 84. Developmental disorders can result when there's a disturbance of the cells during the period when the cells divide. The result is usually a deformity of part of the body. The types of developmental disorders, inherited disorders, are different from developmental disorders because they are caused by an abnormal gene. A congenital disorder is one that's present at birth, either inherited or developmental. However, exact cause of most congenital abnormalities is unknown. Genetic factors, malformations that are often the result of genetic factors such as chromosomal abnormalities. And then you have your environmental factors, which are called teratogens, include infections, drugs, and exposure to radiation. Now, some of these disturbances will be in jaw development, and they're called macrognathia, micrognathia, exotosis, which is a bony, benign growth projecting outward from the surface of a bone. Torus palatis is a bony overgrowth at the midline of the hard palate, and torus mandibularis is a bony overgrowth of the lingual surface of the mandible. And tori are usually on the inside of the jaw. Exotosis is usually on the outside of the jaw. You could also have disturbances in lip, palate, and tongue development. Cleft lip results when maxillary and medial nasal processes fail to fuse. Cleft palate results when palatal shells fail to fuse with primary palate. Cleft palate with or without cleft lip occurs in 1 per 2,500 live births. Cleft uvula, the mildest form of cleft palate, and ankyloglossia, often called tongue-tied, is a result in a short lingual frenum that extends to the apex of the tongue. Now, infants with clefts routinely lose permanent teeth in the course of treatment and development. Modern dental techniques make it possible to preserve original dentition throughout careful monitoring and a treatment plan. And here is what's called a bilateral complete cleft lip and palate. As you can see here, the palate is not fused together and neither is the lip. So that's why you have a bilateral. It is very severe, okay? And with a cleft lip, an infant's dentition may be affected if the cleft involves the gum. Otherwise, it is likely that the dentition will be normal. A cleft of the palate and gum can produce a variety of dental problems, including missing teeth, misshapen or misplaced teeth, and teeth that are slow to erupt. And then here you have the tongue tied. And as you can see, this is a restriction of movement of the tongue due to a lingual frenum that is abnormally short or is attached too close to the tip of the tongue. There is an easy solve for this, and basically they would cut this here, more than likely with a scalpel, and then the tongue will heal. The disturbances in tooth development and eruption, you have ameloblastoma, which is a tumor composed of remnants of the dental lamina. Anodontia, which is congenital absence of teeth. Supernumerary teeth, teeth in excess of the normal number. Macrodontia and microdontia is abnormally large or small teeth. And dens in dent is tooth within a tooth. Formation of a small tooth-like mass within the pulp. And disturbances in tooth development may be linked to congenital diseases, but most are not. Here, the most common variations are peg-shaped teeth. Hutchinson's incisors are a variety of peg-shaped teeth, usually associated with maternal syphilis. Fusion is the joining of the dentin and enamel of two or more separate developing teeth, and gemination is an attempt by the tooth bud to divide. An unsuccessful attempt is indicated by incisal notch. And again, developmental disturbances may be hereditary. Here's some partial anodontia. These are peg-shaped teeth. I know some of them look really sharp, but these right here is like a peg. Unerupted supernumerary teeth. So supernumerary means extra. So there's an extra tooth. Okay, and you can see this here. So there's an extra tooth. Disturbances in enamel formation. Amylogenesis imperfecta is a hereditary abnormality in which there are hypoplasia type defects in the enamel formation. Hypocalcification is the incomplete calcification or hardening of the enamel. Hereditary enamel hypoplasia is a type of amylogenesis imperfecta that is characterized by teeth with crowns that are hard and glossy, yellow, and cone-shaped or cylindrical. With this type of amylogenesis imperfecta, abnormal enamel breaks off from underlying dentition loss. And here is some of that enamel loss. So all the enamel is gone and the dentin is showing, and the dentin is very yellow. So that's why in this picture it looks like this. But there's a lot of other stuff going on. If you look at the gums are unhealthy. They're puffy and very inflamed. There's cavities all over the place. And one of the reasons why is too because the enamel is missing. And without that enamel protecting the teeth, this dentin layer here is not as hard as enamel. So this person will probably need full crowns on their teeth. Now, the disturbances in dentin formation, dentinogenesis imperfecta is a hereditary condition that affects the formation of dentin. Teeth that have dentinogenesis imperfecta are opalescent and have almost an amber color, and the enamel tends to chip away from the dentin, and the weakened tooth or teeth become worn down. Again, it is very difficult to restore these teeth. Bond agents do not work properly with the defective dentin, and it is very prone to decay. Abnormal eruption of the teeth, premature eruption. Teeth are present at birth, natal teeth. Neonatal teeth are those that erupt within the first 30 days of life. Ankylosis in deciduous teeth affected by ankylosis. Bone has fused to cementum and dentin, preventing exfoliation. And then you have impaction. Occurs when any tooth remains unerupted in the jaw beyond the time at which it should normally erupt. Here's a picture of ankylosis. So in this case, the permanent tooth did not erupt. The baby tooth is still there. At this point, it's probably best to keep the baby tooth because, as you can see, this is a deciduous molar. There is no permanent coming in. Okay, so ankylosis can occur at any time during the course of eruption. The teeth become submerged relative to their neighbors. So what happens is because it's small, the permanent teeth override it. Now, again, if it has its roots there and it's still hooked in the jaw really well, more than likely the doctor will leave it there. But, with the letting the patient know that if they don't take care of it, because as you can see over here on the sides, there's some deep pockets there, so they would really need to floss and take care of it. Now, here is an impaction of a third molar, and it's lying down on its side. So something like this would definitely have to be removed. And if it's not, it can cause all types of problems. And then miscellaneous disorders, abrasion, abnormal wearing away of tooth structure caused by a repetitive mechanical habit, such as improper toothbrushing, attrition, normal wearing away of tooth structure during mastication or chewing, bruxism, oral habit consisting of involuntary gnashing, grinding, and clenching of the teeth and movements other than chewing, usually occurs during sleep and is commonly associated with stress or tension. And these disorders are often caused by bad habits or lifestyle factors rather than disease or infection. So here's abrasion right at the gum line. Okay, this could actually be done by toothbrushing. Okay, using a hard bristle toothbrush, using abrasive dentifrice. Dentifrice means toothpaste. Okay, and basically sawing instead of using their toothbrush in a circular movement. And they are sawing across the teeth, making these indentations. And then here is excessively, this is attrition, and this is excessively grinding or wearing away their teeth. And basically the tops of the teeth are all worn down, and that leaves the teeth with stumps. At this point, these teeth can be very sensitive because there's no enamel covering the top, and they're exposed to the dentin and possibly sometimes even to the pulp. Here's another picture of attrition, what it looks like. Okay, so the first one was from the top view. This is from the front view, and you can see how short these teeth are. Okay, so grinding, chewing, this is caused by bruxism. Additional disorders, bulimia, eating disorders characterized by food binges followed by self-induced vomiting. The dental profession is often the first healthcare professional to identify a patient with bulimia. Orofacial piercings have become popular among some segments of the population. Dental complications include chipped and broken teeth and serious infections at the sites of piercings. Infection can spread throughout the head and neck area with serious results. Bulimia has also been linked to an increased rate of cavities. Piercings can also cause uncontrollable bleeding or nerve damage. Then you have meth mouth. The oral effects of methamphetamine use, which are devastating, are referred to as meth mouth. Drug-related xerostomia, which is the dry mouth, poor oral hygiene, frequent consumption of highly sugared soft drinks, and clenching and grinding of the teeth all contribute to rampant caries. And other names for meth could be speed, ice, chalk, crank, fire, and glass, if you've heard of that. And it is also a potent central nervous system stimulant that can cause brain damage, as well as severe oral health effects. And here's what it looks like. So basically, the drug is basically eating away, or as we say, like bombing out the teeth. Okay, so causing these whole like right here at the gum line of the teeth, and sometimes it's the whole entire tooth. Okay, so that is the end of our chapter 17. And do you have any questions?